capacity, and we have been closely watching the results this week, and we'll continue to watch that because the 2-week period is kind of a magical number as far as I understand the gestation period of this virus. So if we have not so far run into any cases, positive cases that were related to a restaurant or a retail business, and that's really good. And we're really looking forward to hopefully moving forward over the next few days, next week or so, to continue to open more business and pull some of the restrictions back that maybe we have now. So we're really hoping that will continue so we're able to do that, because I know we're as anxious for y'all to get back at 100% going as you are. But I am really interested to, excuse me, to hear some of the experiences y'all have had in your business and how it's been working. At least my perception and my observation of the few times I've been in restaurants or businesses, it seems to be going pretty well. I think we're always going to have people that don't want to wear face coverings, but I feel like that is one of the most critical aspects of our community to continue being able to open businesses and keep our cases down are those face masks. So with that, I'll end and I guess turn it over to Mayor Conger.
All right, good afternoon, everyone. First I want to thank you all for what you've done so far. And I'll echo what Mayor Harris has said. This is the 2-week period that we've looked for on new cases related to our opening. Knock on wood, we haven't had any yet. And so, we're with our meeting every day. I think some of you've been in other meetings every morning. City, county, chamber, health department, JEA, emergency management, West Tennessee Healthcare, school system, and United Way all meet and meet for sometimes an hour, 2 hours, and talk about everything COVID related as relates to the state level in Madison County and how we can move forward. And so I'm anxious as well to hear from you to see what has worked, what we need to improve on to support you better going forward, and how we can get to move toward as close to normal as possible during this pandemic. And know that I know it's been a long road. I feel like that April was the longest year of my life, so I'm sure it was the same for you all as well. But we can get to a point as we keep going forward. I think right now we have maybe less than 20 active cases in Madison County. So for the most part, we're all doing our part. And I'm interested to hear what all you all are seeing and what you all are hearing, and your confidence level for us moving forward in the next week or so on releasing some of those restrictions on capacity.
All right, thank you, mayors. Got Jackie Taylor and Amy Garner on here from West Tennessee Healthcare. And if y'all could jump in and just talk to us about the caseload that you're seeing at the hospital and what, from your perspective, how well this community has done in flattening the curve and the outcomes of that. And then from there, and I think the group has grown large enough, we do need to use the chat feature. So if you've got some questions, if you could start loading those up in there. And then some of you, if you'll place in the chat room, if you'd like to talk about some experiences that you've got, then I can go to the screen and unmute you and let you talk about that. Because we, as both mayors said, we do want to hear what your experiences have been.
Yeah, I'll start, Kyle. Thank you. In the hospital, we today, we're very optimistic. We had our low. We only have about 3 COVID patients in the hospital, COVID positive, and 4 in the system, 1 in Dyersburg. So we've usually been running almost every day, 8 to 10 patients in the hospital, about half of those in the intensive care unit, and then about 2/3 of those on the ventilator. So we, which is, still that's significant, but not as bad as we were worried about. We have not had a major surge in population care that we were worried about. The other thing that we're optimistic about, our testing, we started our outpatient procedure and outpatient surgery last week. So we've had a week and a half behind us, and we've had no positive results. And that's testing almost all patients that come into the hospital for an outpatient procedure, particularly those going under general anesthesia and such as that. So I do know one clinic that's not ours here in town, they were doing some of their own testing. They had one positive, but that was a fellow that was already known to be positive. So so a lot of optimism in that area, but we've started with our outpatient procedures. We started slow and are ramping up as we're able to do so. But right now that looks good. So I don't know if Amy has anything else to add or observations from her standpoint.
No, I don't really have anything to add. Dr. Taylor said it all. You know, I've been reporting on our numbers on a daily basis, and we were running, as he said, about 8 to 10 COVID positive patients a day, but this week that number's gone down pretty substantially. So that's great news. I hope that we can stay there and that all of the actions that we're taking will continue to keep those numbers down.
Thank you, Amy. I'll flip it back to Jackie real quick. Jackie, you're a doctor.
Yeah.
But if you were out there today and you owned a small business or a restaurant or a tattoo shop or a hairstylist, and in your case, that might be difficult being a hairstylist.
I'd be broke if I was a hair. Reason one, yeah. What
would you be doing as an owner of that business, knowing what you know with your medical background?
Yeah, I would be cautiously advancing, listening to, following advice on social distancing, apply that. You know what I asked my physicians here, when we started going through COVID, I gathered we have a chiefs of service, and I told them whatever COVID meant for their area, whether it's cardiology, OB, pediatrics, develop that system for your area. Because I would mention that to all of the small business owners to develop whatever that means for your business area, because it's going to be different for a restaurant versus retail, and like you said, all the areas. There are usually some pretty good guidelines out by associations and all. I would follow that. Just the general principle of social distancing and cutting back on respiratory illness, respiratory influences with masking. Just use those general principles for your business and apply those to whatever that means for your business. I would encourage you to start slowly and ramp up as you're able to, but those are just some general encouragements I would suggest. The respiratory part seems to be the key, and that's why I ask people to stay away, still keep distancing from each other, and a mask is really for the other person, not for you. So to consider that, whatever that means, to define that for your business.
Thank you, Jackie. Several people have joined us since I mentioned this earlier. We got started a little late. This is not on Facebook Live, but we're going to put it up later this afternoon. And so we're going to roll through this right now, just like we've got 1,000 people on the call. Earlier, I thought we had few enough where we could just unmute everyone and let you talk. But what I'm going to try to do is, and I've asked you, if you've got a question, to put it in the chat room, is that I'm going to use that and then go back to that person who asked the question and let them go live and ask it. And I've got Brooks Shaw up here. So Brooks, I'm going to unmute you. I know you've got a question.
Hey guys, I have all kinds of questions. I've had no time to do anything but come up with questions. Just a real quick thing. The store is open. We're open in all departments except for the train museum. We're opening that up Memorial Day weekend. The Dixie Cafe has done really well. Our takeout, curbside, we do delivery through there. We're serving breakfast, lunch, and dinner over there, all plate lunches. The buffet, we've closed it on Monday through Thursday breakfast, but it's open the rest of the times. Monday through Thursday, we close and a little bit in the afternoon for extra cleaning. And then the staff's doing a great job of keeping it clean throughout the day on Friday, Saturday, Sunday. It's been really tough. I think that's the same for everybody, especially in the restaurant category. A lot of places aren't able to adapt as quickly as we did. We didn't adapt quickly enough on several things either. So it's been a real challenge for everybody. But our big question is, are we at the point where we're going to be able to actively encourage people to begin getting out and supporting local economy? Or are we still at the point where we're saying we're encouraging people to stay home? I get that people can stay home if they want to stay home, but what are we going to be saying as a community? Is it continue to stay home, or it is now okay to start going out and start supporting your local businesses? That'd be my major question.
Well, for me, it's kind of a difficult question, because there's no doubt that people with underlying medical conditions and elderly people, the absolute safest thing for them is to stay home. I know I have a daughter that has a underlying medical condition from a couple of years ago. And she's also pregnant. Her doctor just told her today, you don't need to go to a restaurant. You don't need to go to the grocery store. You need to have as little contact with the general public as you can because of your issues. And so the question comes in, yes, we want people that are able to go out and support all of y'all in our businesses and our restaurants and things. But there's always that caveat that if there is an underlying condition, I mean, it's inherent on them to take care of themselves and stay away. So yes, I think, Brooks, we're going to continue to encourage people to come out, but we're also going to put a very big word of caution. And people get sick of me talking about face coverings, but at least in my opinion, that's the key to us being able to continue on doing what we're doing and expanding.
Yeah, I echo exactly what Mayor Harris said. I think that's been the message since we've gone back to the reopen of face coverings, wash your hands, sanitize. If you have underlying conditions and you don't feel comfortable, stay home. And I think that, our chamber's done a great job throughout this unprecedented time of trying to, as businesses evolve and do things different, of pushing that information out there and letting people know that there's still opportunities to go shop local, to eat local. We want people to feel comfortable. We want people to feel safe. And that really depends on all of us. And that's why we're having these meeting here on what the comfort level is and safety of, going beyond 50% capacity in restaurants and retail, and how we can do that safely, how we can make sure people feel safe when they do that, while we're encouraging people to go out and spend money in our economy, but do that in a safe manner.
And Brooks, I'll ask you, at least in y'all's operation right now today, would you be comfortable going to 100% across the board?
Absolutely. Yeah, I think the answer would be yes. I think that the great thing about a market system like what we have is the market's going to decide what it supports. So if we don't fill up to 100% capacity, that's a market decision. That's people are not feeling comfortable going to either one place or any place, and they're not going to fill up a restaurant. They're not going to fill up us. They're not going to fill up Asia Garden. They're not going to fill up any other restaurants. But the opportunity is there, and the way we're doing things, all team members are required to wear a face mask. Everybody's in gloves. We're following the proper hand washing procedures. We're serving the buffet. So we're following all these things that are the recommendations of what to do, and doing them as well as we can. But I think at some point it becomes a market decision. The people decide, are we going to fill up a restaurant or not? That'd be kind of my opinion.
And that's a great, Joy Ye had a question, and I think your question's a great follow-up to that, Joy.
Yes. So I went to the webpage and read through the, economic reopening plan. And the only question I had was looking forward to phase 3, will restaurants stay at 50% capacity, or are they going to go up in capacity for dine-in?
Yeah, so I think, that plan was a plan, and it's been very fluid. And so if you saw, what we're doing at the local level, while we're excluded from the governor's reopen plan, we're trying to follow as consistent with the state as possible. And so Mayor Harris and I are on calls with Commissioner Ezell right now, Monday, Wednesday, and Friday, to talk about guidelines and comfort level of moving forward. And so while the plan is there, I think, we're looking at individualizing what we're doing and how we can move to those phases and, specific industries and what we can do. And so really working with the state level on how we do that. So, the plan as it's unfolding is not as, cut and dry as the phased out that we have now. And so that's one of the reasons we're having this conversation today, is to kind of gather the comfort level of how we can move into that opening a dining area up more than 50% capacity.
I gotcha. That explains it. Thank you.
Well, in addition to what Mayor Conger said, one thing that y'all have got to do in your business or your restaurant is that people who come in there have got to be comfortable that they are in a safe environment. And that's going to be a challenge as numbers go up, as far as the number of people in a business and the number of people in a restaurant. And so I think, we have a lot of people who are really scared and concerned, and rightfully so. And so we've got, I think the environment has to be where they're comfortable coming in there. And Brooks, I agree with you. The market's going to determine what that comfort level is. There's no doubt about that.
We've had a few other folks join us, and let y'all know what we're doing here is that, so we've got, I think about 44 people on the call, and everyone so far has done a great job of muting when you should. It's amazing what's happened over the last 2 months. I remember when we started these calls that people didn't understand what a mute button was. They do now. So what I want to try to do, we've got a chat feature here, and if you've got a question, put it in the chat box. And then when I look at that, then I'm going to go to you and unmute you. Adrian Hackett is up next. So the rest of, if you've got any questions, load those up, and then we will come and unmute you and let you ask those and have a dialogue with the mayors. And we've also got Amy Garner and Dr. Jackie Taylor from West Tennessee Healthcare on today. Adrian?
So I have a real quick question. Shockingly, it's about camps, and I was just curious on if there was any guidance in terms of either day camps, whether it be scout camps or vacation Bible schools, or overnight camps that has come out, or any thoughts on that. Thank you.
I know that for day camps, there's been some guidance from the state on 1 counselor, 9 students, no commingling of the groups. So if you're in a facility, then those 9 kids stay in that area unless they go outside, and they're not switching areas and stations. Overnight camps is a great question. If the guidance has come out from the state, I have not seen it. Mac Morris is a unique camp that is, everything is outside. It's a great question that we can take to our next call with the commissioner about that.
And that has been discussed, Adrian, but they have not come up with any definitive guidelines. I will tell you that we had a call, I don't know when it was, we've had so many, but with college presidents last week, I believe it was. And Dub Oliver at Union asked the same question because of their camps that they have in the summer. And we discussed that on the conference call the next day with the state, and they basically said that number of people gathering in one place is just an unsafe condition, at least at the present time. And I do know they're discussing camps and things like that. And I think it will come. The question is, what will be the time frame it will come?
Good question, Adrian. Ginger Manus, I know you've got a question loaded up here regarding spas.
Hey, yes. I didn't know if this was appropriate for the retail and restaurant meeting, but I wanted to go ahead and ask. My question is on the chat box, so it's pretty self-explanatory, but we have been allowed to reopen, and my esthetician is very limited in what she can do due to Governor Lee's close contact business guidelines, which prohibits any procedure that would require removal of a customer's face covering. And so I just didn't know if there were any plans or goals for removing that, requirement moving forward.
I don't think there has been any specific discussions about that at this point, but those discussions continue to evolve as we do have these phone calls and with these other communities across the state. But I don't know that that specifically has been said, you know, at least a estimated time frame of when that would come about.
All right, that's all the questions that are, I'm sorry, I've got one from Andrew Thomas here. And I'm gonna go ahead and ask that and then find Andrew and unmute him. But could a spa not just resume in the way dental hygienists are operating now?
That's a great question that we can find the answer out to.
All right, so we'll work on that. No other questions. See Charlie Garrett on here, and then just because we want to get feedback for the mayors and hospital and health department from different types of businesses. Charlie, obviously, you're at Garrett Heating and Plumbing, and you're going into folks' homes at different times, but what accommodations have you made for your service techs, and how's that worked? And what are you seeing from your customers and their reactions that can help the mayors and everyone make a decision about moving toward a phase 3 reopening?
Well, early on, we got nervous like everybody. So we sort of split our workforce into a Monday, Tuesday, Wednesday group, and then a Wednesday, Thursday, Friday group, trying to get the guys a 4-day window where they were off and away from everybody. We actually worked 3 10-hour days, but we paid them a full week so that they didn't miss any pay on that standpoint. We did that for 3 weeks, and when Jackson-Madison County went to the phase 2, we started bringing everybody back. So we're on commercial job sites where they're beginning to ask us to, have it, get your temperature checked before you go on the site, that kind of thing. They're not really requiring masks at those sites, but those sites we're working on right now are not very populated. It's small crews there. Service, we are going into people's houses. We are trying to just ask them questions before we go, what makes them comfortable. If they want us wearing masks and gloves, we got it. If they're going to stay away from where we are and we can just work independently, we're doing that. We're just trying to make our guys comfortable, make the customers comfortable too. On a side note, I do have a selfish question of my daughter is planning a wedding in late June, and we're trying to figure out, can we have it, or what's the city and county's thought process on gatherings of more than 50 people, that kind of thing.
Well, I think, Charlie, it's kind of complicated. It is in the sense that there is no prohibition from doing that, okay? But there is strong guidance in the sense of the number of people, the social distancing. I'll give you an example. One of these wedding venue places, they wanted to have a wedding up to like 100 people. Now we crossed this with Kim Tedford at the health department, and they also talked to Kim, and their place was big enough that they could group chairs 6 feet apart. They would not have, and everybody wear a mask, not a reception of people around congregating and things like that. So I think it can be done. I think everybody just needs to understand that there is a responsibility that goes along with that. And that is, if somebody attends an event, if somebody goes in a business, if they become positive, then the tracing is going to be back. Okay, where have you been? And so that's the thing that everybody's got to understand, is that the origin of that, the health department traces back wherever that person's been. But I think you can do it. I don't think you can put, if there's a place that's got a 500 seat auditorium, I don't think you can safely put 250 people in there. I think you might put 100 to 150, but that's kind of a case-by-case basis. And Kim Tedford can give you anybody more guidance as far as what is the safest way to go about that than anybody.
So the projection for Jackson-Madison County, what do you guys think down the road, a month, 2 months, 3 months down the road before folks could gather like that?
Well, we're answering those questions based on the information we have today, and just, in all honesty, in the past couple of weeks, there's been conversations of something not going to happen to the end of May, and then 2 days later, we're going to do it Monday. So this situation is very fluid. There's no playbook, and so that's why we're trying to gather as much information as we can. And today that makes me nervous of a wedding with 100, 200 people in it, but June 27th, we may be to where we're comfortable with it. I mean, I know for planning purposes that doesn't help you out. I'm having a meeting with my Sportsplex director here in about 30 minutes, talking about tournaments in June at the Sportsplex. I asked that question to the governor's office today, and they said, not now. So we're canceling the first 2 weeks of sports tournaments at the Sportsplex through the middle of June, and then we'll come back and reconvene start of June and project on out to the end of the month. So we're working on kind of a 2-week projection instead of trying to go too far out and knowing that information changes on a daily basis.
Thank you.
All right, Brooks, see you've loaded up another question. I'm gonna got you unmuted. I think your dad's got a question.
Yeah. Hey guys, can you hear me okay?
Yes.
You didn't have to see my face, but anyway. Good to see everybody. First of all, let me just say thanks for holding these meetings, number one, for all of those of us in retail and hospitality. We appreciate the data, the input, the information, the fact that you're interested. That's huge and helps a lot. I want to salute the governor. I know the governor did everything he could to hold off closing as long as he could compared to other governors, and I'm so thankful for that as well. And I thank you guys, because I know that you opened up, a week before an awful lot of folks did, and thank God for that too. This is from our perspective, okay? I know other people may not have, feel the same way, but I want to salute you. I know, I cannot imagine the weight on your shoulders, knowing the decisions you're making and how they're impacting lives. And so thank you for your leadership. But I'll tell you, on the side, I'm, as Brooks has said, let the market decide as much as possible what's going to happen with some of this stuff going forward. Totally get why we closed when we did. I'm in the camp. We're past needing to reopen this economy badly. And I think if you look at the health statistics, and again, you can argue because of what we did, we have the health statistics we have. But I think you can also argue that media hype on all of this was way overblown. So, but not having to go there, let me just say, thank you for what you did. I think when we do, if you go back to 100%, if you're like us and other restaurants that I've been around to in town, I've been to them, I've driven around them to see what others are doing. The quick service places, for the most part, are doing pretty good with the drive-throughs. I was in another popular restaurant here recently. 3 other tables were there at 7:30 at night in the middle of the week. And so it's not just us, it's a lot of people in the same boat. If you do go to 100%, we're not going to put the tables back out at 100%. We're at 50% now. It's 160 seats altogether, and it looks good. And we're going to keep that safe distance for a while until business comes back. But guys, if we don't get the word out that unless you've got an underlying condition or unless you've been exposed, and to get this economy going again, we're going to be as a business, we're going to be in very serious trouble soon if people don't start coming back to restaurants. It's not just ours. And of course, I saw a statistic the other day where 100,000 plus businesses have gone out of business in the country, and a whole bunch more are going over the edge every single day. So the word has got to be getting back out. We have got to get the economy going. We got to get people out again, and you can do it smartly and safely and with the mask and with the social,
but we got to get the message out. We're open for business as a community. Come and see us. So that would be one of my just encouragements to you guys to help us. Yes, say if you've got a condition, yes, stay in. If you're in an elderly situation, you know, we understand if you need to stay in and you're concerned. But for the most part, most people, again, there's 100,000 people in this county, and how many cases are in the hospital? I mean, 1, 2, none. I mean, we can't stop the whole economy for this, and so that's just my encouragement. And my last question on the phasing was this: are we about to enter phase 3? Are we in phase 3? Are we about to go to phase 4? Is phase 4 complete opening of everything, and when does that take place, or when does phase 3 fully take place? I'm not sure I'm understanding that.
Great question. Yeah, I think it's, to your first point, it's what we're doing now. We're trying to get back to that open, and trying to encourage people to do that. In the phases that were laid out, like I said, from the start, they're fluid. And so we've been working with the state on specifics of guidelines. And as we get guidelines down from the state, then we can make adjustments. So it's a fluid living document that gets amended, and the plans get changed because of our cooperation and collaboration with the state. And so, I'd say the next major, reopen action would be the removal of the 50% capacity at restaurants. And so that's, what we're looking, and retail. So that's what we're looking at here today, to making that possibly for next week to do that.
I agree with that. And that's what, if our numbers hold, and so far they are, Clark, and they're doing well, that we do get back to that 100%. Now, I do think there's still going to be guidelines on that, certainly the distancing and the mask and things like that. But it's kind of like condiments on the table. I mean, people touching the same ketchup jar, you don't want that, because if that person is positive, that can stay on that glass or that piece of plastic for hours. So the next person who uses that, same thing with a buffet line, people using the same serving pieces. So even though we're going to 100%, there's still going to be guidances. But yes, we're knock on wood, if we continue the way we are, I feel comfortable we're going to be going to 100% sometime next week.
Thank you, Clark and Mayors. I've got a question from Mickey Martin. Mickey's director at the Lift Wellness Center. I know a lot of you know her. The Lift is a certified medical fitness center, and after speaking with a state official, she has confirmed that their aquatic facilities have been lumped into the general guidelines for recreational pools and water parks. The CDC is clear that COVID-19 cannot spread in a chlorinated environment, so the issue is more about physical distancing. Our pools are therapeutic, and many of our general members are physician-referred members. They're losing mobility as a result of not being able to use our pools. For many of them with physical limitations, it is the only mode of exercise they can tolerate. It would be very easy for us to maintain physical distancing in both our lap pool and our therapeutic pools for members to exercise. What would the process be to begin a discussion about reopening our pools for our members?
I think at the state level, that's already happened, because that also was grouped in with hotel pools. They all got grouped in together. And so that discussion is already happening, and we can surely revisit that on Friday when we talk with the commissioner's office about how we can get some language and some guidelines for those therapeutic and exercise pools as well.
And as well, I think one of the first calls needs to be to Kim Tedford at the health department, because Kim's well aware of how the lift works and the pool and things like that. And I think that a discussion with her would be a good start on that. And then Scott and I getting a clarification from the state on just kind of what would be the guidance there.
All right. Thank both of you for that. And we've got a few more minutes left. I know several of you have joined here in the last few minutes. What we're doing, if you've got a question, load that up into the chat room, and then I will either go back and unmute you and let you ask that to the mayors and the folks at West Tennessee Healthcare, or I will do that. I'll let the mayors kind of talk about this for a second. The process, of how you're going to make the decision, how the group will make the decision about moving to phase 3, and why, again, this conversation today is important to that.
Everything that we've done has been a consensus from that group that meets every morning, and so we've had that discussion, and a lot of weighting the decision on the 100% capacity in retail and restaurants is dependent on this meeting. And so, obviously, hospital capacity is the number one metric we look at. Number of cases is the number 2, and then active cases. And so we feel like we're in a good spot. We just wanted to get that comfort level, that the readiness and willingness to lift that 50% capacity restriction. And so we will meet tomorrow and Friday, and then have a decision on what that looks like and when that will happen.
And as well, this has been from day one a collective decision on everybody's part, including the healthcare industry as well as the chamber and business and things like that. But I think we are almost totally guided by the health department. I mean, because they have to be comfortable on the direction we're going, that it's not going to cause us a calamity 2 weeks down the road and we've got to come back and do things different than we started. And so we're cautiously moving that way. And I think we're going to get there. I really do. I think our numbers look good. But there's always a question that comes up about this kind of business or that kind of business that's not just really defined in the governor's guidance. And what we do, as well as what we advise other people to do. If you've got a question about your business or some process or procedure you do, call Kim at the health department, because she's very well versed on the safest way, if possible, to go about it.
If there aren't any other questions, we'll wrap up. I would like to pitch it back to Jackie and Amy just after listening to this conversation. Anything else the two of y'all would like to add?
Amy, I think your thoughts are good. Just let's follow the data, as Mayor Harris said, and open as we can, be safe for our patients, our community. I think I agree with echo Mayor Conger said earlier also that a week of COVID time is about like a month. That just so much happens. It's and you change. This is fluid. If you just think about it, 6 months ago, we didn't even know this disease existed. And trying to make decisions now, just we don't, the information, we're building this as we fly it almost. So I think you're, fortunately the community's done well. And I think the early measures, although they're aggressive, did pay off and help us to be where we are now, and hopefully we can continue that. So.
Thank you, Dr. Taylor. Amy?
Yeah, I just want to echo what Dr. Taylor said. And I also just wanted to thank everybody for all the community support that you all have given the hospital during this. I know that closing your businesses or limiting capacity has not been easy. And this whole crisis has certainly not been easy on the hospital system either. But we have seen such an outpouring of love and support, and your restaurants have fed our staff members, and we've had donations of supplies from retail stores and restaurants. And I just wanted to say thank you from the bottom of our hearts at West Tennessee Healthcare for everything that you have done for us. And thank you for helping us flatten the curve and help us put some infrastructure in place to prepare for a surge of patients if we should have to do that. That gave us some time to buy some supplies and ventilators and things. And so I just want to say thank you very much.
Thank you, Amy. And unless there's anything else, we're going to wrap this up. This was recorded, and we're going to pitch this out to Facebook this afternoon. So if you've got some friends that need to watch this, or if you just want to see yourself asking a question or what you look like online, it'll be up there today also. And appreciate both mayors joining us, Amy and Dr. Taylor. And I'll tell everybody that's on this call, if you've got any questions, everyone through this whole process has made themselves very available. So whatever questions those are, just reach out directly to the person that you think can best answer that. And then let's hopefully look forward to a phase 3 reopening in our future very soon, and that we keep our numbers as flat as we possibly can, and have a great rest of the week.